So these are the tests for the elbow, and the first one is the elbow extension test. So if Stefan came in with an acute injury to the elbow, I would ask him, can you extend your elbow all the way? And since he's able to, he does not need radiography, but if he were not able to extend all the way, I'd recommend that he got radiography done. And then the next one is you test the MCL. So go ahead and grab at the elbow, and you're testing for the, you're placing your finger on the joint space over here, and test it at 0 by applying a valgus force and looking for any gapping in the joint, and then test it at 20 to 30 degrees of flexion. And then you can do the same with the LCL on the outside. Once again, feeling for any gapping in the joint, do it at 0 and do it at 30 degrees. And then from there, and a positive for either of those would have been excessive gapping or pain. And so from there, you can do Tinel's test by holding their arm flexed at 30 degrees, and you're just tapping the ulnar nerve and seeing if they feel any paresthesias or reproduction of symptoms, any abnormal sensation in primarily the bottom 2 fingers. From Tinel's, we do the tennis elbow test, looking for lateral epicondylitis. And so you pronate the patient, have them make a fist, and bring their knuckles all the way to the air. And from there, support at the elbow, and you're trying to pull them out of their extension, and then have them relax, and you're going to apply a stretch. And if they have any pain or reproduction of symptoms on the lateral epicondyle, you know that it's a positive test. Next, you go into the medial epicondylitis test for golfer's elbow. And so once again, have them make that fist and bring their fist up, support at the elbow, and pull down. And then have them relax, and you're going to bring them into that stretch once again and see if you can reproduce any of the symptoms on the outside there. Alright, so next we have the Pronator Teres syndrome test. And what the patient's going to do is you'll have them grab your forearm, and you're going to tell them that you want them to do this motion or pronate over and over. And while they do that, you're resisting them, and you are extending their arm forward. The idea here is you're trying to activate the Pronator Teres and see if you can reproduce any symptoms of the median nerve going through that muscle that would maybe cause paresthesias across the front of the arm. The next test we're going to do is the elbow flexion test. So for this one, it's a test that you need them to repeat for a good while. So a good way to do it is have them go on like an arm bike, and you're testing for medial cubital tunnel syndrome, where the ulnar nerve gets impinged. And so they'll just be biking, and they'll be doing flexion and extension of the arm over and over. After that test, you have the Supinator syndrome test. And so you grab the forearm again. Well, first you check grip strength. So go ahead and squeeze my hand as hard as you can, Steve. And you want to test it bilaterally just to see where they stand. And it's going to be a lot like the Pronator Teres syndrome test, but for this one, they're going to be trying to do the supinating motion. And you repeat it a few times, just resisting them. And have them repeat that motion, seeing if you can create any pain in the radial nerve across the back side of the arm. And a reproduction of symptoms or paresthesias would be an indication of a positive test. And then you can follow it up to see if they have weakness in extending their wrist back while you pull down. And if you had just provoked the radial nerve, they would have difficulty extending their wrist like that, or they would be weak anyway. And then the last test, testing for the posterior interosseous nerve, is the anterior interosseous nerve branch of the ulnar nerve, is just seeing if they can touch their fingertips together like this and make the OK sign. And a positive test would be not being able to do that.